Hi, it's Dr. Sweeney here tonight to talk about RSV, which is respiratory syncytial virus. Now, this is the cause of a condition which is really common just now in babies and infants called bronchiolitis, which is a virus which can affect the respiratory tracts of young children. It can cause wheeze and breathlessness, and difficulty with breathing. It can result in babies and infants becoming more unwell, dehydrated, can lead to secondary bacterial infections, pneumonias, etc. So it can prove to be quite serious. Now, it is particularly common at this time of year in the autumn and the spring, as the temperature changes, and we see a lot of it. And the vast majority of babies that come in can be safely managed at home, treated like any regular virus with fluid support and regular medications to reduce temperature and to keep them comfortable. But if they become more unwell, breathing a bit harder, a bit more difficult, sometimes you can see indrawing of the spaces between the ribs, you can see the tummy, the abdomen moving more, any kind of sign of a blue tinge, any kind of cyanosis developing, signs of dehydration as well, which means sometimes the fontanelle, which is the little sort of indentation on the top of the head, that can become a bit recessed, that can be drawn in. And if the child is a bit dry, one of the main ways of judging whether a child becomes dehydrated and might need fluid input via a hospital is all to do with their nappies. So whether the nappies are wet and dirty, so whether the child's producing urine and opening the bowels is a good sign. So if the nappies are getting drier, the child is getting tireder, more withdrawn, breathing harder, then sometimes getting an assessment by a doctor for possibly admission to hospital for a bit of support through the worst of the virus can be helpful. Now, support often takes the form of oxygen therapy. Sometimes if they develop a secondary bacterial infection, then antibiotics can be helpful. But because RSV is a virus, usually antibiotics don't work, and it's just supportive measures to help get them through it. So, as I say, if your child is unwell, don't hesitate to get them checked by your local healthcare provider. And if you are worried that they're deteriorating, then please, get help whatever time of day or night it is. Until next time, stay safe.